Hi, I'm Dr. Polly Watson with Hormone Wellness MD. Today we're going to talk about advanced testing options and how we can use these to connect the dots with all the complex systems in our bodies that affect hormone balance. Did you know that your microbiome affects how you clear your estrogen metabolites? I didn't know this. I went through 12 years of postgraduate education. I became a North American Menopause Society certified practitioner and maintained that certification for 10 years. And I still didn't learn about the microbiome and how it affects estrogen clearance until I took functional medicine training. So there are lots of diverse systems in our bodies that affect our hormones, and it's all connected. And so these advanced tests are cutting edge opportunities for us to get a little bit more information about what's going on. The first test I'd like to share with you is called the Dutch test. Now, typically measuring hormones, we measure hormones with serum, with blood, and also with saliva, either multiple times a day or at certain times of the month. The thing that's unique about the Dutch test is that it looks at hormone metabolites. So if you're giving someone hormones or they have a hormonal imbalance just naturally in their system, we can see how they metabolize those hormones. Estrogen detoxification can go down a non-toxic pathway or a toxic pathway that predisposes that person to get breast cancer. So this can be a really helpful guide in guiding people through the risk-benefit decision to consider bioidentical hormone replacement. The other cool thing about the Dutch test is it also can look at the methylation system. Methylation is another part of detoxification that is susceptible to nutrient deficiencies as well as genetic variants. And the Dutch test can also provide insight into how healthy someone's methylation system is. The next test that I'd like to discuss with you is a comprehensive stool analysis. And it sounds kind of gross, but I've done this myself. You collect stool for 3 days at home and send it to a lab. And the information that you can get from a comprehensive stool analysis is quite impressive. So we can get some concept of the microbiome, if there are good guys there or bad guys there. We can also get information about things like yeast overgrowth or parasites. We can get some nice information about pancreatic enzyme activity as well as bile acid activity, which affect how our digestion works and how our nutrient absorption works. We can also look at something called short-chain fatty acids, and these are critical in looking at not just what kind of bacteria are in the gut, but do they have what they need to eat? So the short-chain fatty acids are food for the good bacteria in your gut. And oftentimes these are low in people who are on really low carb diets, so it can be helpful to look at that. So comprehensive stool analysis is another insightful tool that can give us a lot of information about multiple aspects of your digestion and your nutrient absorption. The last option of testing is doing food sensitivity testing. Sometimes people get really hung up on the difference between an allergy and a food sensitivity. So I'm going to take a stab at explaining this to you in a pretty basic way. So many people might have celiac disease where they're allergic to wheat protein. They have an immediate reaction, which is an IgE-mediated reaction, to wheat. There are other folks that might have an IgM-mediated reaction where they don't get sick immediately after eating wheat, but they have fatigue or headaches or sort of vague symptoms of just not really feeling their best days to hours after ingesting a substance like wheat. So food sensitivity testing tries to look at foods that might promote this vague not feeling your best, and we can get a lot of information about a person. I like to close out my comments on testing by saying that I'm still a huge advocate for spending time with patients and getting a good history. No patient in my practice is going to be forced or pressured into getting expensive tests, and I don't mark these tests up at all because I want patients to understand that if I recommend a test, it's not because I'm going to profit from it, but it's because I really think it could provide some helpful information. So you've learned a little bit about Dutch testing, comprehensive stool analysis, and food sensitivity testing. I hope this information is helpful to you and helps you understand what cutting edge options are available at our practice. Thanks so much for watching.